What are ligaments and why are they so important?
So a ligament is fibrous material that attaches bone to bone. So a ligament is designed to help provide stability and structure to a joint and to prevent excess movement in that joint as well.
How long do ligament injuries tend to take to heal?
With a ligament injury, it depends on what kind of injury you've sustained. So they're graded from 1 to 3. So if you've got, say, a grade 1 ligament sprain, the fibers are still intact, but they've been stretched excessively and are quite uncomfortable at that stage, and might take about 4 to 6 weeks to settle down if you're following correct tips and advice to promote healing. If it's a grade 2, you'll have partial tear to those fibers, which would take a little bit longer to help them realign and come back together nicely. And then with a grade 3 sprain, the fibers have completely ruptured, and that can take quite a long amount of time for it to heal because you need those fibers to meet together and regenerate and realign as well. So that can take a couple of months realistically.
How do you know when you have a ligament injury?
If you suspect you have a ligament injury, normally it would occur through either an accident or through playing sports. For example, it would take a bit of a hit or a blow to cause it to rupture. Sometimes people say that they've heard a loud pop. They might have quite a lot of swelling or bruising around the area. On top of that, because the ligament is designed to help provide structure and stability to a joint, you might start to notice in that joint that it's not as stable and you start to get excessive movement, so it feels a little bit wobbly almost. So that's when you might start to think it could be a ligament that you've damaged.
If we get a ligament injury, what should we do next?
So if you do suspect a ligament injury, ideally you'd want to rest it, ice it, put a bit of compression on it and elevate if there's some swelling. If you suspect it's quite a bad one, or if you're in quite a lot of pain, go and seek help. See a professional. You can come to a physiotherapist. You can go and see a doctor to have it properly assessed to see what's going on, and then we can take it from there, depending on what kind of a sprain you might have, or if you've had a full rupture. The main things to remember about it is to get your pain under control. Be quite careful about what movements you're doing, so you don't want to put too much through it. Allow it the time it needs to heal and settle down, and then gradually get back to your day-to-day activities if you can.
Great, thank you.